There is a manila folder in the bottom drawer of my desk at home. I keep it under a stack of old tax returns because I can't throw it away and I can't look at it. The tab is labeled in my own handwriting, Medical, 2021, which is funny, in a way that isn't funny at all because I wrote that label. I organized that folder. I thought I was the one keeping track. The folder holds a 2-page form. Standard document weight, the kind of paper that has authority by feel before you've read a single word. My name is typed at the top. The designated agent line names Linda Carol Whitmore. And at the bottom, on the patient signature line, there is my handwriting again, the same handwriting that labeled the tab, signing something I never read, handing over something I didn't know I was handing over. Linda had already called my doctor about my treatment preferences before I had told a single person on Earth what I had just been diagnosed with. Stay with me, this one gets dark. My name is Megan. In the fall of 2019, I was 35 years old, a senior financial analyst at a consulting firm in St. Louis, and I had just passed the 2-year mark of a marriage I genuinely believed was good. Not perfect, no marriage is perfect, but structurally sound in the way that matters. Tyler and I had met at a work event, dated for a year and a half, gotten married on a Saturday in October with 68 guests and a dance floor that stayed full until 11. We had a daughter, Sadie, who was just turning 2 and had her father's dark eyes and an opinion about every single thing. I was good at my job. That becomes relevant later. I spent my working hours reading documents other people didn't want to read, looking for the line that changed the meaning of everything above it. I was trained to find the thing hiding in plain sight. For 2 years, I applied 0 of that skill to my own life. Tyler's family was close. That's the only way to describe it. His mother, Linda, 61 at the time we married, trim, capable, always in a sensible blazer, had spent her career as a hospital administrator for a large regional health system. She retired the year before Tyler and I got married, and she had transferred the organizational efficiency of that career directly into the management of her family relationships. She remembered birthdays, sent cards, tracked what Sadie needed before I had mentioned it. She was, by every surface measurement, an extremely competent woman who loved her son and was making a sincere effort with his wife. The first time something felt slightly wrong, I dismissed it within the same afternoon. It was 4 months into the marriage. I had a minor health issue, a UTI that wasn't resolving, nothing serious. I needed to switch antibiotics. I called my primary care doctor's office, and they told me my patient portal account had been recently accessed to update my emergency contact information. They asked me to confirm it. The new emergency contact was Linda. When I brought it up with Tyler that evening, not even as a complaint, just as a thing that had happened, he nodded and said his mom had offered to help set up my portal login because the interface was confusing, and she'd mentioned something about updating the emergency contact while she was in there. He said it so easily, like it was the kind of thing that got done. I stood at the kitchen counter with my phone in my hand. The refrigerator hummed. Something in me wanted to pull the account access log and check the timestamp, check which day she'd been in there, cross-reference it against every conversation we'd had about the portal setup. I didn't do it. She had access because I'd let her help me set it up, hadn't I? Or had Tyler just assumed I had? I wasn't even sure anymore. I filed it under the general category of Tyler's, mom being helpful in ways that occasionally required course correction, and I moved on. That phrase, helpful in ways that occasionally required course correction, was the version of Linda I held in my mind for 2 full years. I built an entire narrative around it. I told myself I was a rational person who did not manufacture conflict where none existed. Linda had a phrase she used constantly. Whenever she inserted herself into something, a decision Tyler and I were making, a plan that involved Sadie, anything in the arena of family logistics, she would say, I just want to make sure the right information gets to the right people. She said it warmly. She said it with genuine-sounding concern, and it always landed as reasonable because on the surface, who could argue with that? Information. People. Right. The sentence had no edges you could grab onto. I just want to make sure the right information gets to the right people. I would hear that sentence again, years later, in a context that would make me want to put my fist through a wall. The patient portal incident was the first thing. The second thing happened 14 months into the marriage, and it was worse in proportion to how much more ordinary it seemed. I had my annual physical in January of that year. Nothing notable, routine blood work, standard forms, the kind of appointment you go to and forget. Tyler's mother called me the next week and mentioned, in the course of a conversation about Sadie's pediatrician, that she had heard from my doctor's office about a follow-up reminder. A reminder for a follow-up I hadn't been told about yet. I asked how she'd heard that. She said the office must have called my emergency contact. She said it very calmly. She said, "I just wanted to flag it for you. I know you're busy." I called the doctor's office. They confirmed that a follow-up reminder had been left with my emergency contact because their call to my cell had gone to voicemail and they had a secondary number on file. I asked which secondary number. It was Linda's. I went home and I told Tyler. And this is where I need to be careful about how I describe what Tyler did, because it is easy to say he dismissed me, and it is more accurate and more important to say that he did something more specific than that. He heard what I said. He paused. And then he said, "Mom was a hospital administrator for 20 years. She knows how these systems work." He said it in the tone of someone explaining a resource they were grateful to have access to. And then he said, "I can call the office and have the secondary number removed if it's bothering you." The word bothering, like this was an itch. I said yes, please call. He said he would. I don't know if he ever did. The third incident is the one I should have acted on immediately, and I didn't, and I have to live with that. 6 months after the follow-up phone call situation, Linda offered to help me organize my medical records. She framed it as a practical service. She knew how to set up a system. She had done it for Tyler's father before he passed. She knew what to keep and how to file it. Tyler thought it was a wonderful idea. He said, "You're always complaining about the filing system in the home office. Mom could knock that out in an afternoon." He wasn't wrong that I complained about the filing system. That was the thing. Linda was always right about something real, something true, something you could verify, and the entry point she chose always had that grain of truth in it. So I said yes. I left her in the home office for an afternoon while I took Sadie to the park. When I came back, the files were organized and labeled in a system that was, objectively, better than the one I'd had. Linda was in the kitchen making coffee, looking like a woman who had spent the afternoon being helpful. The whole house smelled like it, coffee and competence, the particular scent of someone who wanted you to feel taken care of. I checked the folders. Everything was in order. A part of me, the part that had spent years cross-referencing contracts against source documents, noticed the tabs were in Linda's handwriting rather than mine. I noted it. I decided it didn't mean anything. What I didn't check, because I didn't know to check, because I didn't know it could exist, was whether anything had been added. By the spring of the second year of my marriage, I had developed a relationship with Linda that I would describe as managed cordiality. I had not built a case. I had a collection of incidents I had never formally connected to each other, because none of them, individually, crossed a line I could point to. Tyler had his mother on a pedestal I had learned not to approach directly. Sadie loved her grandmother. Our lives were structured in a way that made Linda's involvement feel load-bearing, which I understood, on some level, was not an accident. And then I started getting sick. The fatigue came first, then the headaches, then a persistent sense of something being slightly off in my own body that I kept translating into explanations that were logical and finite and didn't require further investigation. I was 36. I worked long hours. I had a toddler. I rationalized for 8 months. There was one evening, this is the detail I keep coming back to, where Sadie had a cold and Linda had come over to help for the afternoon. I was on the couch under a blanket, running a fever I'd been dismissing for a week. Linda stood in the doorway of the living room holding a glass of water she'd brought me without being asked, and she looked at me for just a moment before she looked away. Not with concern, with assessment. I noticed it and I put it in the same drawer as everything else. I was sick and tired, and I needed the help, and the drawer was getting very full. When I finally went back to my primary care doctor, she ordered a panel of tests I hadn't had before, referred me to a specialist, and told me she wanted to investigate a specific set of possibilities. She used clinical language, careful language, the language of a doctor who doesn't want to alarm a patient before she has data. I left that appointment knowing something real was being looked at, and I had not told Tyler yet, and I had not told anyone else, because I was 4 days out from the referral, and I was waiting to have information worth sharing. 4 days later, I walked into the specialist's office, gave the front desk my name, and watched the intake coordinator look at her screen with an expression I couldn't quite read. She said, "Oh, it looks like your emergency contact has already spoken with the physician about your treatment preferences." I asked her to repeat that. She repeated it. I asked her which physician. She named my primary care doctor. I asked her when. She said 3 days ago. I had not told a single person about that referral. Not Tyler. Not a friend. No one. I had a diagnosis being investigated that was 4 days old, and I had not breathed a word of it to another human being. And Linda had already spoken with my doctor about my treatment preferences. It wasn't panic. It wasn't even anger, not yet. It was something colder, the specific sensation of understanding, suddenly and completely, that you have been living inside a structure someone else built without telling you, and you only just now walked into the wall. I excused myself from the intake desk. I sat in my car in the parking garage for 11 minutes. I know it was 11 minutes because I watched the clock. And then I did what I do at work when a document doesn't add up. I stopped trying to explain it and I started looking for the source. I was a financial analyst. I knew how to request records. I knew how to read them when they arrived. I called my primary care physician's office from that parking garage and said I needed my complete medical file, not a summary, the full file, every form, every document ever associated with my name at that practice. They told me it would take a week. I said I understood and I gave them my home address. The file arrived on a Tuesday. I opened it at my kitchen desk while Tyler was at work and Sadie was at daycare. I went through it the way I go through a financial audit, page by page, looking for the thing that shouldn't be there. I found it on page 43. It was a 2-page form. Standard document weight, the kind of paper that means something official. The header read, Durable Healthcare Power of Attorney. My name was at the top. The designated agent line read, Linda Carol Whitmore. The date was 14 months into my marriage, 3 years ago. And at the bottom, on the patient's signature line, my handwriting. I read the form 3 times. Each time I reached the designated agent line, I stopped. Each time I made myself continue. This document, bearing my signature, gave Linda Whitmore the legal authority to make healthcare decisions for me if I was ever deemed incapacitated. It gave her the right to speak with my physicians. It gave her the right to override, or direct, or shape my medical care in ways I would never know about until I walked into an intake office, and a coordinator said something that stopped my blood cold. I sat very still for a long time. And then I thought about the afternoon she had organized my files. And then I thought about something even worse than that. Before I tell you what happened next, if you're as shocked as I am right now, hit that like button and subscribe so you never miss a saga like this one. Because I promise you, it gets so much worse before it gets better. Now, back to the story. Linda could have slipped that form into a stack of papers, but someone had to put the stack in front of me. Someone had to hand me the pen. Someone had to be standing there, in our kitchen, watching me sign a document I didn't read. I thought about Tyler saying, Mom was a hospital administrator for 20 years. She knows how these systems work. I thought about the word bothering. I thought about the fact that he had never once, in 2 years of marriage, told me to check my medical files. I thought about how easy it would have been to say, hey, Mom had you sign something back when we first got married. You should probably know what it is. I thought he would have had to know. I called Tyler at work. I told him I needed him to come home. He said, is everything okay, Sadie? I said, Sadie is fine. Come home. He walked in the door at 4:15. I had the form on the kitchen table. I had not moved it. I let him see it as he came in from across the room. I watched his face. He stopped walking. I said, tell me about this. He was quiet for a long time. Not the quiet of someone who doesn't know. The the quiet of someone deciding what to say. And then he said, "Mom asked me to have you sign some paperwork when we first got married." "Just standard family emergency stuff," she said. "I had a stack of insurance forms from open enrollment, and I threw it in with those." I said, "You knew what it was?" He said, "Look, I thought it was reasonable. She spent her whole career in hospitals. She knows how." I said, "Tyler, did you know what that form said?" A pause, then, yeah, I knew. Said like a man admitting he'd forgotten to return a library book. Said with that particular flatness of someone who had genuinely never understood the size of what he was carrying. I didn't raise my voice. The thing I felt in that moment was not the kind of thing you can reach with volume. I said, quietly, "You watched me sign something and you did not tell me what it was." And he said, "I figured you'd skim it. I figured if you had a problem with it, you'd say something." I said, "Your mother called my doctor 3 days ago about treatment preferences for a diagnosis I hadn't told you about yet. She has had legal authority over my medical decisions for 3 years. And you knew that, and you did not tell me." He put his hands on the back of a kitchen chair. He looked at the table, not at me, at the form on the table, and his jaw moved once without making a sound. I said, "I need you to leave for tonight." Tyler went to his brother's house. He did not go to his mother's, which I noted, and which mattered to me more than I expected it to. I called Linda. She picked up on the second ring, which she always does, because Linda is always available in the way that people who want to be needed make themselves always available. She said, "Megan, hi. I was just thinking about Sadie." She said this with warmth, leading with Sadie the way she always did when she sensed I might be calling about something else. I said, "Linda, I'm calling about the healthcare proxy." A beat of silence, and then she said, "Oh, I've been meaning to talk to you about that." Her voice shifted into something I can only describe as professional warmth, the tone of someone managing a situation they have already prepared for. She said, "You know, after Tyler's father got sick, I just realized how important it is to have things documented. I just wanted to make sure the right information gets to the right people." There it was, that sentence, that exact sentence in this context. I said, "You spoke with my doctor 3 days ago about a diagnosis I hadn't told anyone about." She said, "I was just making sure your file was in order. Megan, I have 20 years of." I said, "You had my chart accessed before I had made a single decision about my own care." She said, "Sweetheart, I was trying to help." And then she said the thing. Said it almost casually, like she'd forgotten to be careful. "Honestly, Megan, someone in this family needed to stay on top of your health situation because you clearly weren't going to do it yourself." I let that sentence sit in the air between us. I said, "Thank you, Linda. That's all I needed." And I hung up. If you've been watching, Linda just showed you exactly who she is. Drop your location and the time right now in the comments. I read every single one of those. Now back to the story. The healthcare proxy was revoked within 10 days. I contacted an attorney who specializes in healthcare law. Her name was Rebecca. She was 40-something, sharp, and she did not blink once during our consultation. She confirmed that the document was legally valid as signed, and that Linda had acted within her legal rights to contact my physicians. Revoking it required a signed revocation form filed with every medical provider who had my records on file. I sent revocation notices to 6 facilities. I tracked everyone to written confirmation. The last confirmation came back on a Friday afternoon. I printed it. I walked to the home office, opened the bottom drawer of my desk, and placed it in the manila folder behind the healthcare proxy itself. Then I closed the drawer. I stood there for a moment with my hand still on the handle, and what I felt was not relief exactly, more like the specific quiet of a door that has finally been locked. Then I sat down with Tyler. The easy version of this story makes Tyler a villain. The true version is more complicated and also more important. Tyler was not a man who had helped his mother harm me with intent. He was a man who had prioritized his mother's logic over my autonomy without ever examining the cost of that choice. And when he finally had to examine it, he found something in himself he didn't like. He sat across from me at that kitchen table. The same table where he had once handed me a stack of papers and watched me sign them, and he looked at his hands. He agreed to couples therapy. Not because I ultimatumed him into it, but because when I said I did not know if I could trust his judgment after this, he said I know. He said it like a man who understood exactly what he was conceding. We went every week for 4 months with a therapist named Dr. Calloway, and it was hard and honest and not comfortable, and Tyler said things in those sessions that I had needed him to say for 2 years. Tyler also called Linda himself and told her that any access to my medical records, patient portals, or healthcare information was permanently revoked, and that any future contact with my physicians would be considered a legal matter. He did not ask me whether he should do this. He just did it and told me afterward, and that was the first time in the marriage that he had made a decision that cost him something with his mother without asking me to absorb it first. Linda did not apologize. She sent a card, a physical card, handwritten, that expressed she was sorry I felt this way, which is not an apology. She knows that. I believe she doesn't care about the distinction. She has seen Sadie twice in the year since this happened, both times in contexts I controlled completely. That manila folder is still in the bottom drawer of my desk. I've thought about throwing it away, and I keep deciding not to, and I've finally figured out why. That document, that form with my signature on it, is the clearest evidence I have ever seen of the way control moves through families. Not loudly, not dramatically, through paperwork, through access, through one person saying, I just want to make sure the right information gets to the right people, and another person standing at a kitchen counter deciding that sounds reasonable enough. I was a woman who read documents for a living. I signed that form without reading it because I was newly married, and I trusted the person who handed it to me, and I believed that trust was a reasonable response to love. Here is what I know now. Trust and verification are not opposites. The people who love you and the documents they hand you are two entirely separate things. Read every page. Sign nothing in a stack. That's the thing Linda taught me. I don't think she meant to.